All right, well, we'll keep that on the down low. It'll just be between you and me. No one else will hear about this. Well, hello again, and welcome back to In Search of 42. My name is, of course, Felix Becker, and I am your very own success coach on this journey we call life. This week, I am really excited to share with you my conversation with Demetrius Kirk. Demetrius hails from Detroit, Michigan, but that's not where he lives right now. He is a nurse, a nursing home administrator, and so much more. As a healthcare consultant, he is just as frustrated as I am about the healthcare system, and we cover that topic in great detail. Also, what he does now as a healthcare consultant as well. What I really loved about the conversation was the banter we had. We had some disagreements, but we had a wonderful conversation about it. We were friendly about it, we were cordial about it, and I think you can learn a lot about how to have a real discussion when you have disagreements on a certain topic by listening into our conversation together this week. Now, again, as before, if you like this stuff, if you get value out of it, please do me a quick favor. Hit that like button, subscribe, rate and review, share this episode with a friend, because doing all those little things on your part helps me reach more people. More people just like you who are looking for the answer to life, the universe, and everything. And listen, the more people I can reach, the more people I can help. But that was a lot. So with all that out of the way, I want to get into my conversation with Demetrius Kirk. Remember, his contact information is in the description below, so if you want to reach out to him, if you want to work with him, you can do so. And if you want to work with me, my contact information is below as well. But that's all for now. Let's get right into my conversation with Demetrius Kirk. Yo, Demetrius, so nice to see you again. I mean, I'm just absolutely thrilled to have this conversation with you yet again. I know we did this a few weeks ago for your podcast, and I know we connect on LinkedIn a few times, and it's just been honestly killer conversations. So let's get right into it. You know, the thing I want to say, that what I'm trying to showcase to the world with these conversations is who you are, what you do, and how you can help people, right? So the first question is this. Who are you?
Hey, man, first of all, thank you, man. And to your point, right, we have had some of the best conversations, and our conversations just seem to flow. So I appreciate the opportunity to come on here and to show the world the conversations we have behind closed doors, because I think the conversations we have behind closed doors could benefit others, right, could benefit the masses. So who am I? Well, my name is Demetrius. I am from Detroit, Michigan. I'm a registered nurse by trade, licensed nurse home administrator, healthcare executive, and that's me in a nutshell, right? I am currently residing in Honolulu, Hawaii, and I've been here for about 3 years. So that's me in a nutshell. I know you're going to ask more direct questions, but that's really me in a nutshell.
Yeah, no. And I think that part of your story that you were just kind of like glancing over, right? I'm from Detroit, but I live in Hawaii. I mean, I think that's a fascinating part of your story that we definitely need to get into. So let's start with Detroit. What was Detroit like? Why did you ever leave? Tell us. Start from the start.
Listen, man. Growing up in Detroit, right? I'm an '80s baby, as they say, end of the '80s, but '80s babies nevertheless. And I spent 31 years of my life in Detroit. In Detroit, it is great, man. It is a great, diverse city. It is a great city. Detroit is I'm not even going to say it's on the come up. It is there. It is back, baby. You saw the Lions these years, right? It is there. But for me, growing up in Detroit, I faced mountains of health issues because I was an asthmatic. And one year, I think 2015, we came to Hawaii, and by day 2 in Hawaii, I had noticed that I wasn't carrying around any of my asthma medication. I didn't have an inhaler anymore, and that was tethered to my side. I mean, it was surgically implanted in my hand in Detroit. The air was so bad, and I didn't know. I grew up there. I knew no difference. But I did notice by day 2 in Hawaii back in 2015 that, hey, I'm climbing up the side of a volcano. Something I never thought I'd do as a young black man from Detroit, but I'm climbing up the side of a volcano, and I forgot my inhaler at home. So it was then that I realized, by day 10, hey, I'm not needing medication here. This might be something we want to look into. So me and my wife, we made a pact. We said, look, we're going to stay for about 5 years, and we're going to move to Hawaii, So I think when we were sitting on the beach saying that, I think we were kind of, joking about it, but it was some level of seriousness to it. We went home, really put some more thought into it, and we started saving. And then 2020 came around, and that big C word came around, right? COVID came around. So we said, look, we're not going to move in the first year of COVID, but hey, if we're still feeling this in 2021, we're going to do it. So in 2021, man, we put our bags and we put our hopes into a basket, right? And we moved to Hawaii with no job, no house, no nothing. We just up to move. We have no family here. We know no one here. I mean, 3 years in, I still don't know anyone. But we just believed in faith and we moved to Hawaii, man. So, for us, it was just a chance encounter for us to come down here, spend 10 days, realize that, hey, I got the best health. And then we believed in ourselves, believed in what we could achieve. And we just up to move to Hawaii, man. So thank you for asking that, because I think that's often something that I do kind of gloss over. But to somebody out there who's wanting to step out on faith and wanting to believe in themselves, they may not know that they can do it. So I'm here to tell you, hey, you can do it. Just believe in yourself and you're not going to fail.
Yeah. No, absolutely. And I think there's something else to unpack about your time in Detroit, which are your health issues. You're right. I mean, you're a nurse. I'm a surgeon. So we're both in the medical field. And we've had this conversation before where we talked about this, right? When you went to see your pulmonologist, right, your specialist, and you carried all those inhalers around, and, maybe they went as far as saying you need a lung transplant. I don't know. But did anyone ever say, Demetrius, if you moved out of Detroit to a place with better air quality, your asthma would go away?
No, so when we talk about, how bad my asthma is, for your audience, I'm going to make it the most layman's terms that I can, right? Because I know it's a diverse set of people watching. I was on prednisone, 40 milligrams of prednisone daily, and other steroidal medications. And anybody that's taking prednisone know, it creates an insatiable appetite. You're just eating whatever's in sight, right? So when you're eating whatever in sight, you get bigger. Your other health elements come out. You get pre-diabetic or diabetes. You get hypertension or high blood pressure. All these other things coming out. And no one ever said, hey, would you consider moving? What they did tell me is all the things I could not do, but they never told me what I could do to make it better. So as I said, this was just a chance thing that we decided to fly to Hawaii. It was a last minute thing, and I fell in love with the island, and my breathing was better. But to your point, no, we knew I couldn't have any dogs, cats, horses, any animals. We knew I couldn't have carpet in my house, but nobody said, hey, maybe you should think about moving outside of the city or moving somewhere where there is cleaner air. I don't know why that option wasn't on the table, but I think if that option was on the table younger, I might not have had to have so many years taking that amount of steroids.
Right. And like you said, taking steroids is no laughing matter, especially taking them long term. I mean, steroids really are not designed to be taken long term. They're fine in the short term, right? If you have taken for a week or two, that's perfectly fine, maybe a month at most. But really, if you're dependent on them for the duration of your life, that's really not what they're designed for in the first place.
You're 100% right with that. And like I said, I go back to, I remember going to the eye doctor at like 24, and he's like, hey, you got cataracts. I'm like, whoa, that's what 24-year-old, with cataracts, right? And he's like, well, you're on this long-term steroids, and that causes cataracts in the eyes. So, that was something that I had to come to terms with. Hey, my health is starting to fail because of the steroids. But if I don't take the steroids, my health is definitely going to fail. So I was really in the catch-22. And I go back to your question, right? Nobody thought to say, hey, how about you move out of this environment, right? I happen to stay in a city called Romulus, Michigan, right? And that was where the major airport is. So I can't even imagine, self-reflecting now, the amount of toxins and fumes that was in the air, because that's where all the airplanes landed. But I was 3 blocks away. So what was that really doing for my health in the long run?
Absolutely. And I think what's important to recognize is, again, you come at this from a medical background as a nurse, right? Most people who walk into a doctor's office don't have that background. They don't have that knowledge. They don't even know sometimes what questions to truly ask to figure out what's really going on and what they really should be doing. You have that background, you have that experience, and yet you still, we're subject to a poor healthcare system, right? I mean, if you think about it, what really all we're doing is fixing problems. Nobody ever really took inventory of Demetrius and said, all right, this is what you actually need to do to live a healthy life. It was, all right, you have asthma. We got to put you on this inhaler. it's still not controlled. Let's put you on steroids. Oh, now you have cataracts. Go see the eye doctor. Now you have diabetes. Let's put you on insulin. Now you have hypertension. Let's put you on this med, right? It's always just fixing the problem that's in front of us instead of looking at the global picture of who is this person, what is going on in their life, and what really needs to change to fix all of it, right? To change all of it, to not just fix the problems, but actually find the solution to a healthier life. And that's really, I mean, that's been one of my gripes with the healthcare system as a whole, because especially in my world in the last 4 years in wound care, people just come at me for a specific wound, and a wound will only do as well as the person as a whole is doing. And so it's you have to take an incredibly holistic approach, right? If your diabetes is not controlled, if your heart failure is not controlled, right? If you're still smoking, it's all those things add up to the wound, which is the only thing that you see on the outside. I mean, you don't see diabetes, you don't see heart failure, you see the effects of it, but you don't see the problem itself. And that was always incredibly challenging, because people only came to my clinic and said, well, I have this wound, I want you to fix this wound. I'm like, yeah, well, hang on. There's so many other dimensions to you that we need to address, right? And I get 15 minutes to address 20 different dimensions in your life and create the documentation to create the, to satisfy the legalities and the billing requirements, right? I mean, it's just impossible. It's an impossible task to truly provide health care and not just problem care. And it's really sad to see someone like you go through all of that. And I'm happy that you found Hawaii, right? I mean, that's just beautiful. You found it, and all of a sudden things went better for you. But so in Detroit, you were, what were you doing? You were still working as a nurse at that point?
Yeah. So in Detroit, so let me give you a quick background on my a quick story on my background, right? I am a registered nurse by trade. I started off at 18 as a certified nursing assistant. Very early on, saw that I can do more, became a licensed practical nurse, and that journey just continued, right? I saw that I can do more, got my bachelor, got my RN, then my bachelor's, and it was in that moment that I got my bachelor's. I was working in a nursing home, and I was reporting to a administrator, and a patient had a fall. And the administrator was questioning me as a nurse, as director of nursing, as to why we were doing the interventions that we were doing. And I said, hold on, I can't keep reporting to someone and telling them and having to justify why we're trying to perform the care that we need to perform to save this person's life. So for your viewers, right, this person was on a blood thinner. This person fell, hit their head, they were bleeding. We had things that we needed to do to stop the bleed, right? But it didn't align with the culture's expectation or the company's expectation of revenue and expenses we should have been doing, right? They thought it was cheaper alternative. Well, as a nurse, my job is to prevent the bleed and to stabilize this patient. And it was at that moment that I said, I can't do this no more. So I went back to school and became a licensed nursing home administrator, because I wanted to sit in that seat and I wanted to drive clinical and operational excellence. I wanted to marry the two, my two backgrounds. So I wanted to marry the two and be there for the patient. Not always have to sit there and say, okay, we need to focus on the revenue. At which point do we focus on the patient? Because we won't have jobs if we don't have patients. And if we keep pricing them out the ballpark or not performing quality care, they're not going to return. So it was at that moment, as I said, I became a licensed nursing home administrator and started working in that role. As I was working in that role, I went back to get my master's in nursing. I also went back to get an MBA in business administration as well. So, I really wanted to drive operational excellence and clinical excellence. So when you say what I was doing in Detroit, hey, I was sitting at the table, not sitting on the table. Because before I got the advanced knowledge that I needed to sit at the table, I was on the table. I was being told that, hey, for this patient that fall, you just can't do this, right? So I wanted to sit at the table. So, to answer your question, I was in Detroit working as a healthcare consultant, sitting at the table, driving clinical and operational excellence. Oftentimes, and I'm sure you're a physician, you can attest to this, right? Decisions are made at the top by people in suits that have no understanding of clinical. They are there to drive KPIs. They are there to make the board of directors happy. And they're not really portraying the truth as to what's happening with the patients and the outcomes. We hear HCAP stores, we hear JCOs here, but what does that really mean when we say that, right? When we say we're a patient-centered organization, what does that really mean? Does that truly mean the patient's at the center, or the patient's at the center as long as their wallet is at the center?
Yeah. No, you're so right. And definitely what I've seen, that's one of the reasons that really burnt me out as a bedside physician was this whole idea of profits over patients, right? I wasn't able to provide the care that the patients truly deserve and desire because it was all about me providing the right documentation to cover the legalities and the billing requirements and not actually providing the care to patients. I wasn't really helping anybody other than, some other third party, fill their pockets with money. So and that really frustrated me because that's not how I like to live my life. Just like you, I actually went, if into medicine to help people, right? I love helping people. And that's really what frustrated me and burnt me out. So, and you're right. The problem is that the people at the top aren't suits and they're profit driven. They don't have that clinical background that you and I have. I mean, the thing with HCAP scores, right? I remember in my residency when they came out and we told all the patients about it. I mean, I sort of was like, I felt like a used car salesman, right? Make sure you give us a 5-star review.
Yes.
But I didn't really know what that meant. And I actually, at the time, I wasn't quite aware of it as I am now. But I asked patients if they knew what this actually meant, right? Or what it meant to be a magnet hospital, because we were a magnet hospital, right? And I still don't fully understand what magnet hospitals are myself. But I asked patients, hey, did you know that we're a magnet hospital? And they said, yes. I was like, what does that mean? I don't know. Right. So the only people that actually care about that, the only people that actually matters to are the people on top who are driving money. The patients and the bedside providers, they don't care. Doesn't make a difference to them, right? They're just there to actually help people. And all this other stuff distracts from that. It takes time away from actually helping people. So you come to Hawaii, and I actually have another question for you, obviously in your long educational run, but you come to Hawaii. You said you had no plan, right? So what did that look like? What if your last few years looked like in Hawaii then?
So Hawaii looked very interesting to me, right? Because I had no perception of what Hawaii was. When we came in 2015, we stayed in Waikiki. Very touristy, right? We got it. We had a rental car. We drove around the island, but I wasn't in the city, right? I didn't really understand what I was getting into. I saw what I wanted to see, right? And Hawaii is just like any other state, right? You're going to have your good sides. You're going to have your bad sides. You're going to have your ups. You're going to have your downs, right? And when we got here, we ended up finding a house 7 days before we landed, like literally 7 days before we landed. We found a guy online. We did what we probably shouldn't have did, but it worked out. We sent a down payment and hoped that when we got off the plane, he was there to pick us up. This is a true story. Like, this is stepping out on faith, man. We had no car. Here's the deal, man. We lived in a 1,400 square foot house. We packed everything in 4 suitcases. If it didn't fit, we did not take it. So with that being said, when we gave him that down payment, we just believed that he was going to be at this airport to pick us up. So to kind of reduce the risk, I came 2 weeks before my wife came. So that way, if he wasn't there, then it's like, oh, well, I lost a little bit of money. I'll find a hotel and find us something. Thank you to whoever, because he was there. We got the house. Everything worked out. When I got here, I didn't have a job. I knew that I was a registered nurse. I was a licensed nurse home administrator. I had 2 master's degrees, project management, all these other accolades after my name. And I just knew I would find work. So I took some time off, right? It was the middle of COVID. It was 2021. I had worked as an executive and as a nurse all throughout that time up until we moved. So I thought, I'm going to take some time off. I took some time off. It took roughly about 3 months off. And then I started to put my resume out there and try to interview. What I found out very early on is this state, for what it's worth, is very relationship based, right? Because it's only so big, right? It's only so big. So it's relationship based. So I didn't find a job as quickly as I thought I would find a job, but I'm grateful for the opportunity that I did get. Once I started putting myself out there, physically attending events and meeting people, I was able to make those connections and land a role. I landed a role at a hospital as a consultant to the hospital. Very quickly, I shifted from a consultant after about 3 months to a C-suite executive at that hospital. And then I helped very quickly close that hospital, that side of the division of the hospital, right? They were a post-acute care hospital. I closed that division of them. And then I found myself unemployed again. I was only working that role for a year, and I found myself unemployed again. Here I am. I came in as consultant, C-suite executive, and then became unemployed. So it was in that moment that I was trying to figure out what's next for me, right? What do I do next? And I reached out to a coach. I got me a coach, and I started to kind of make smart goals, as I say, right? Started to say, okay, where am I going? And that coach helped me make these smart goals. And from there that I started to get into consulting for myself as well as professional coaching for myself. So when you say, what do I do now? I work as a healthcare consultant across the U.S. as well as a professional coach, helping people establish their own smart goals and helping them drive towards their excellence.
And you do all that from beautiful Hawaii.
Listen, so blessed to do this. And once again, it's what's interesting about life, as I'm sure you're aware, right? You never know where it's going to take you, right? We have our plan, but it doesn't mean it's going to align with the universe, right? If you would have told me that what I'd be doing now is working, through S.I.M.P.L.E and providing people and helping people with professional coaching and helping them get their life and their professional and personal lives on track, I would say, no, I'm comfortable being a C-suite executive. But sort of like yourself, you got there and you was like, I'm still not driving the change that I thought. You get burnt out. And I think what's important is for anyone, when you start to show signs of burnout, you're actually not helping the patient. You're not helping anybody, right? You become grumpy. You don't want to show up to work. It's just, it can pour over into your personal life. So what I had to do after that is say, okay, what's going to make me happy? How do I put my mental health first and myself first? And once I found happiness in myself, I was able to pour that into other people.
Yeah, absolutely. No, you're so right. It all starts with you, right? If you're not in a good place, if you don't know where you're starting from, I mean, it's the same thing I always tell people. If you don't know where you're starting from, how do you know how to get to where you want to go, right? You may have an idea of where you want to go, but if you don't know where you're starting from, what route are you going to take, right? It starts with you. You got to know who you are, what your core values are, what you stand for, really, who is Demetrius? Who is Felix, right? Who is whoever, right? But you got to know who you are. And that's really also the power of a good coach will unlock that within you to really understand that, because that is something that I was struggling with for a long time myself. And it wasn't until I started receiving coaching myself that I started to solidify that picture in my head, like who is Felix, right? And what do I stand for, right? What am I here for? But outside of the coaching thing, so you mentioned a really interesting point, and that is it's about who you know, right? That networking aspect. And that makes such a huge difference, right? Who you know will drive everything, right? Will drive opportunities. It will open the right doors. If you don't know the right people, it doesn't matter how hard you work. I mean, we had this discussion before we recorded, right? About, how we both learned more on YouTube in the last few years than we ever learned in years of school. And you said, I mean, your LPN to RN to BSN to MSN to MBA. And are you working on your doctorate?
Yeah, I'm wrapping up my doctorate now.
You're working on a DNP as well, right? So, I mean, you have dozens of diplomas on your wall, right? And yet they almost don't matter. It's all about who you know. Right.
This is, that is so true. And nothing rings more true than when I came to Hawaii. And as I self-reflect, I didn't have this time in Detroit because I knew people. People knew me. I had a base of support. I started at the bottom as a CNA, so people got to watch me grow from this 18-year-old entering in the field, this charismatic 18-year-old who wants to make a change. So I was able to attend conferences, do speaking engagements and things like that. Then I get here where no one knows me, and you got to restart from scratch. You got to build that base again. You got to make those connections. So to your point, right? It wasn't until I self-reflected, it was like, wow, I had that base of support back in Detroit that I don't have here. But hey, I'm a people person. I'm an outgoing person. So I'm out here making these connections, and I'm not going to bury my head in the sand for all intents and purposes. I'm not going to bury my head in the sand and say, oh, no, I can't make it work, right? I stepped out here on faith. I believed in myself, so I have to continue that journey. Just because it gets a little difficult doesn't mean I need to sidetrack. And I think that's what people have to understand, right? Life will have its ups and downs. When it's good, it is great. When things are going good, I mean, think about when you graduated medical school. Probably one of the happiest times you've been in your life, besides maybe when your kids was born or you got married, right? One of the happiest times. But then in your darkest days, right? It is in that time we must dig deep to be able to move through it, right? One of my sayings that I love to say is you survived 100% of your darkest days. If you're sitting here talking to me, you have survived. And if you're sitting here listening to me, you have survived your darkest days before. So while this time period may seem dark, you will get through it. You are smart enough to get through it. You have the knowledge and you have the bandwidth to get through it. What we need to do is, whether it's connecting with, Felix, myself, someone else, You need to sit there and connect with somebody who's going to be open and honest with you. Where people go wrong is they surround themselves with yes men or yes women. They're not telling you that you're running into a wall. And they're going to sit there and watch you run into that wall, right? They're going to see that. Get you somebody who can really say, you know what, that makes no sense. Let's ground you in reality. Where are we at? To your point, where are we starting from? We know you want to get here. We know Demetrius wants to find a job. But what's reality? How do we get Demetrius to find a job? And that's what I had to do. I had to ground myself in reality and realize I have no base here. How do I grow that base so I can get to that job?
Right. No, you're so right. And people surround themselves with people that you make them feel better, right? I mean, I think that's a natural tendency. But if you really want to grow, if you really want to excel, you need to go beyond that. And I'll tell you, I mean, for me, I come at this, I'm a surgeon. I definitely fit in with a surgeon personality. I got no time for bullshit. So, I'll tell my clients right up, look, this ain't the truth, right? There's something else going on here that we need to dig deeper on, right? Yeah, and I'm not here to just powwow and kumbaya and cheer you on. If you deserve that, absolutely, we will do that. But at the end of the day, I'm here to help you grow as a person. And I come at this from the love that I have for you as a person to truly want to push you in a way that will help you grow and succeed. So I'm not doing this to be an asshole, right? That's really not what I'm doing. I'm truly doing this because I love you and I want you to be better. And I know we all can be better. And I think on that same note, one thing that really resonated with me was when you said, if you made it this far, you've made it through all of your dark periods. And that really resonated with me because I have a history of depression, right? I've had suicidal ideations going back for a very long time. And just thinking about that I have made it through those moments. I mean, last week was terrible for me, right? Even my girlfriend was like, what's going on with you? I was like, I honestly don't know. And I hate being in those times because I'm aware enough of it that it's going on. And I'm like, I can't think myself out of this. It's terrible. So, but knowing that I've done it before is honestly, is the one thing that is so far has always kept me going, right? I've done it before. I will do it again. It's just time to push you forward. But listen, I'm curious if you will allow me to challenge you on two things, only because I want this to be an academic challenge, right? I want this to be a philosophical challenge. I want this to be an open discussion. I don't want you to feel like I'm attacking you in any way. But there's two things that I think you and I can hammer out, and I'm only doing this with you because I know from my previous discussions, you have the know-how to help me out here. All right?
Yes.
So the first one is quite simply, all these nursing degrees, right? The one thing I have never understood is the progression of these different nursing degrees. In my mind, right? The easiest way it's always been described to me, and the way I love looking at it, is nurses treat patients, physicians treat diseases. So and that's been sort of the way I've looked at it. And from that standpoint, to me, a nurse is a very practical position, something that's done at the bedside, that you truly have to interface with people. It is not a skill you can learn in the classroom.
Yes.
And so it has never made sense to me to for the hospitals to get rid of LPNs and to force RNs into BSNs, into MSNs, and even into DNPs for that matter. So what is it? Because on the physician side, we don't see that, right? What is it that you truly get out of a bachelor's of nursing that an RN couldn't do? Because in my mind, it's something that should be done at the bedside, in front of people, with people, and not in the classroom. So what do all those extra levels of degrees actually add to the skill of a good nurse?
You know, that is a fabulous question, and I have a difference of views and opinions on it, but I will answer it as diplomatic as I can, and I love the fact that I can always be open and honest with you. So, the fact that we are nurses, and there's different levels of us as nurses, create some of the issues that we have in healthcare. And I'm one of the nurses that may not, that others may not agree with, right? The reason, and I'll get to your question, but you hit a nerve. The reason we as nurses can't ask for more money is because we have too many entry points, to your point, right? Where you can be an LPN, RN, 4-year, 3-year technically. There's still diploma nurses, right? 3-year, you can be an MSN and enter into the field. but we're never going to be able to ask for more money because there's always going to be someone with less schooling, less experience that's going to say, hey, I'll do this, for $40 an hour. There's a 2-year person, and I'm an MSN. I'm not going to work for $40 an hour, right? I got a master's degree in it. So, what these entry points do is make it confusing for even physicians such as yourself to understand our value as nurses. Because to your point, we all are registered nurses. Now, with that being said, we all are registered nurses, but as we advance, we gain more operational, more critical thinking skills in theory. That's what they say that we do. So when you think about a 2-year nurse, right, this is or an LPN, right? An LPN learns literally the skills of what they need to do to treat the patient. I was taught in Detroit, Michigan by a group of MSNs and DNPs. They were on us, right? You will not be a difference. There will be no difference in the knowledge you have from an LPN to an RN. So for me, I'm one of the ones that would say I don't really see a difference from an LPN to an RN when it comes to the skill set. Even the critical thinking, because critical thinking is not something that can be taught, that has to be developed. Right? There's no book that says how to critically think. You just have to be there. You have to be in the trenches. You have to want to connect those labs to the diseases, to the medications that they're giving. You have to want to do that. And I don't think that there's a difference between LP and RN. It's just whether you can critically think or not. Now, when we talk about what is the difference between a 2-year and a 4-year? Well, on paper, they say a 4-year degree nurse is prepared to enter into management. So when I went from a 2-year to a 4-year, my courses were more focused on leadership development, coaching, organizing the team, and making them understand why we have this evidence-based practice, why we should be inserting catheters the way that we do, and not deviating from the standard. So that's the bachelor's level nurse. You get to the master level nurse, now you prepare to implement that evidence-based practice, right? The DNPs developed it, the PhDs developed it, the MSNs can implement the evidence-based practice, right? And they can teach the generations under them. So the MSN, as I'm an MSN instructor, I can teach the BSN students coming up. I can teach the ASN students or the LPNs coming up. So when we talk about the master's level, right, they're often starting to enter into that collegiate levels. They're your directors in organizations, and they're the ones who are truly driving that clinical excellence. We get to why Demetrius is getting a DNP and why there's a DNP there, right? Well, you have 2 levels of terminal degrees, technically 3, in terminal degrees in nursing. You have the PhD, you have the DNP, which is the newer one, and then there's a doctorate of nursing sciences as well, which is equivalent to that PhD. PhD, as you know, are more research-based, right? Those are the nurse scientists. Now, DNP, such as myself, I'm considered a nurse scientist as well, but I'm more along the lines of helping that PhD nurse who developed that evidence now take it back to the system, right, as a DNP nurse, and take it back to there and say, how do we implement this? Train that MSN, and then they carry it out as I've described earlier. So that DNP level nurse is a nurse scientist. I can do research, right, as well. I can come up with new evidence-based practice. But what we do know that when PhDs develop evidence-based practice, it takes over 10 years to get to the bedside. Why? Because they're nurse scientists. They're not clinical doctors like yourself. You have a clinical doctorate. I'll have a clinical doctorate as a DNP. So once they take that evidence, I, as a clinical doctorate, can now help implement that into practice. So, there is a need for the structure, how we have it. Do I agree with it 100%? I don't, because we can't ask for more money because everybody takes the same licensure, right? The 2-year is the same licensure. The 4-year is the same licensure as the 6-year. I don't have to do any additional licensure, but the knowledge that I'm gaining or the knowledge that I'm getting is more in depth. So, I'm hoping to answer your question and provided some clarity as to why we have different level of nurses. And, there is, for being frank, there is a difference between a DNP, a BSN, an MSN, an ASN, and an LPN.
Sure. No, I want to push back a little bit on that though. And I come at this from, I know plenty of, and I'll tell you, if I need a good nurse, I'm looking for the 50-plus-year-old RN. Right.
Yeah.
Because they have that bedside experience. They know what it takes clinically. And it's just that experience and that critical thinking is well developed. And I know I can depend on them. So the problem that I've seen in the last 20 years with all these different degrees is the nurses that come out of school with a BSN or MSN have less clinical experience. Yes, they have a quote unquote higher level degree, but they have far less clinical experience. So at the clinical bedside, they're not as dependable. The critical thinking is not there. And it seems like it's not even something that's instilled in the schools. And at the pace that these schools are now crushing out all these young nurses, there's just no time for that. It almost seems, coming back to our point earlier from before we were talking, that a lot of the universities, a lot of these colleges are really just designed to make money and not really to prepare people for what they're actually supposed to be doing. So that's on the clinical side, right? I think these advanced degrees, again, they sound great on paper, and I agree with everything you said, but I just don't see the reality of them actually making better nurses. As a matter of fact, I see the opposite. I've seen them making worse bedside clinical nurses. And now on the flip side of saying, I agree that if you want to go into management, into leadership roles, that's where those advanced degrees possibly come in, right? Because you learn extra things that you may need at those levels. The problem now is exactly what we said before. Now we have people in the leadership positions who don't have any clinical background, or very limited, very little clinical background, or clinical background that's 10, 15, 20 years ago, and is no longer relevant to what we're doing today. So we have that disconnect now. Right? We have worse nurses with fewer clinical expertise, not as good clinical skills at the bedside, but a more advanced degree that costs more money, and therefore they can command a higher salary, but the clinical skills really aren't up to par, versus we have these advanced degree nurses who are in leadership who also don't have the clinical background to truly know and understand what it takes to make the healthcare system truly a healthcare system.
But to your point, right? I think that's in all avenues, right? I've met plenty of physicians that are physicians, but they've never touched a patient, right? And they're running ACOs, they're running home healths and things like that, and they've never touched a patient besides their clinical rotation. As I go back to, right, critical thinking is not something that can be taught in class, right? It's not like, when you're doing the test puzzle, even as a physician, right, you have these whole case studies, but really, it's not till you touch that patient and you're gaining that clinical excellence, you're gaining that clinical experience, right? So for any provider, anything, I think that you need to have some bedside experience, right, before you move into any roles. Now, I can't make an organization hire only people with bedside experience, right? To your point, right, they're looking for somebody with that clinical education. Now, to your point, you said something earlier, is that, hey, these nurses, they're coming out and they have tons of theory hours, but not enough clinical hours. I don't agree with that. I think that we should definitely, as we advance, still have the same amount of clinical hours. But to your point, that is one of the issues that we have in nursing. And this is, I go back to, we can't demand more money. I met someone, and I used to mentor someone who was an MSN nurse. All they were was an MSN nurse. And you may say, well, what does that mean? That means they got a second degree and became an MSN nurse. They came out of school with less technical clinical hours, hands-on patient care, but more theory hours. And they were geared to teach the next generation of students. And I was like, how is that even possible? How can you be teaching the next generation of students? But that's a flaw in our system. Just like there's a flaw in every system. There's a flaw in DO, MD, PA, NP. There's always flaws in the system, and people will learn how to exploit them flaws, right? But to your point, I do think, or to your question, I do think that there is a need for advanced degree nurses. What you mentioned is that 50-year-old nurse, and what has taught that 50-year-old nurse is experience. And experience can't be brought. It can't be brought at all, right? At some point, anything in life, your experience is going to trump your education. You sit here and be an MD for 30 years, you're still going to be the best thing since sliced bread because you have experience. Theory can only teach you so much. The books can only teach you so much. You and I both know when you're sitting in school, you got the perfect patient, right? You're focused on one disease process at a time. But when you get out there, that patient's going to have multiple comorbidities. As you mentioned, right? We're talking about holistic care. They're here for just the wound. And you're trying to treat them holistically. And I think that's where the disconnect is with any schooling, whether it's MD, DO, NP, FNP, OT, right? How do we give these students the experience they need to be successful once they get out there? So they're not getting out there with these advanced degrees, landing these management roles because of advanced degrees, but you and I both talk to them and they can't find their way out of a paper bag. It's frustrating to me. I don't have the answer to it, but I go back to your initial question, right? Do we need different degree levels? I do. Some countries start their RNs at a BSN level. Now, I do understand why RNs started at a 2-year degree level, right? Back in war times, things like that. We needed easier entry points to get people into the field to treat the patients that were there or treat the soldiers, right? But now that we've kind of getting away from that, how do we equipped our nurses with the right skills at the right time, right? And I don't know that we can fix this now, because what are we saying? There's a national shortage of nurses. So are they going to do away with the LPNs? Never. They can't. There's a national shortage of nurses. They're never going to get RNs in long-term care. It just doesn't happen. It's not going to happen. There's not enough revenue there to pay RNs what they deserve in long-term care. Hell, LPNs are not getting paid what they deserve in long-term care. So we definitely are going to get someone with more advanced schooling in long-term care. And the same goes to, us in the hospital, right? It's very interesting, and I'll say this and turn it back to you, right? I've been saying this a lot. When other organizations or other industries go on strike, they go on strike. So when you think about Ford, GM, Chrysler, when they go on strike, they go on strike. They halt that production line. The company loses millions of dollars, and the people on strike eventually get what they want, because they don't break the strike line. But what do we do in healthcare? Whether you're a physician, a nurse, anyone, we break the strike line because the organizations make us as nurses, physicians, everybody feel like, oh, you're harming the patients. You're doing this to the patients. It's not us. You're not giving us the adequate tools. As nurses, we're fighting for, basic, to go to the bathroom, to have safe patient ratios, right? We're fighting for the most basic things. But what happens is people cross that strike line. So we're never going to improve the healthcare because we're doing it to ourselves. We go on strike, we cross the strike line. And I say we cross the strike line because if we were all bachelor's or master's prepared nurses or DNP prepared nurses, we all understand. But as long as you have a 2-year or LPN or another degree under you, they're like, I would do it for cheaper. I will cross that strike line. And it drives the situation. It drives the state of healthcare that we have today. Sorry, I'm passionate about it.
No, listen, so am I, right? It's a huge problem that we both have identified, and it's a huge problem that this whole country is going to suffer from, right? Because there's a nursing shortage, absolutely, across the board in all states. There's a physician shortage as well, and it's only going to get worse because we have an aging population that's going to require more physicians and more nurses, and we have more nurses and physicians leaving healthcare because the system doesn't support us to do things the way we want to take care of people. We're supposed to take care of people. We should be able to take care of people because the system profits over patients, right? The system only cares about the profits. It doesn't care about the patients. And we care about patients. We don't care about the profits. So there's that huge disconnect. And obviously no one has figured this out yet. People throw out socialized medicine. I'm like, well, socialized medicine won't fix anything either. Look at this country, right? People say socialized medicine will fix this. Having a single payer will fix all of this. I'm like, no, it won't. CMS is already the most common payer across the country, and CMS doesn't get it right. So just because we're saying, right now I think it's like 70% of reimbursements are handled by CMS, right? So now we push that to 100%. Like, what difference does that really make? Yeah. It doesn't make any difference. It doesn't change anything. We essentially already have a single payer system, whether you're with CMS or if you're in a big system like. You already are in a single payer system, and they still don't get it right. So a single payer system isn't the answer. A multi-payer system, the problem is that the different payers, right? The big problem is really that we are giving a third-party control over how the money flows in healthcare, right? Instead of a patient being able to come to me and say, Dr. Becker, I'm going to pay you to take care of this problem for me. They're saying, Dr. Becker, I'm coming to you to take care of this problem for me, but I'm paying Mr. Smith over their money that he's going to give to someone else who's going to then eventually pay you, right? And so us as first line bedside clinicians, we're the last people to put our hands into that pot of money. And so obviously there's going to be scraps left for us. Everyone else has already had their hands in there. And so that's a huge problem. So the way the payments work in the system is a huge problem. And I see this with some of the private patients that I still see on the side. I don't deal with insurance. I say, look, if you want me to be your physician, that's cool, but you pay me cash directly. That's it. Simple enough, right? That also means you get direct access to me. I don't deal with insurances. You don't deal with insurance. You only deal directly with me. If you have a problem, you come to me. Right. And that's it. Simple, easy. and patients actually get better care, because now I can go there and I can actually spend time with patients and not have to deal about the regulatory BS that I would have to deal with if I was dealing with insurance companies or other healthcare systems. Anyways, I know we're both passionate about this. We could talk about hours for this, but let's move on. I want to kind of hammer you on a different subject that you brought up. And again, this is a philosophical, academic kind of discussion, and I really want this to be sort of intellectual. But I do want to push on something, and that is, you mentioned SMART goals. Now, we all know SMART goals. SMART goals have been around for a long time now, and I know I was taught SMART goals when I went through my coach training, and everybody seems to love SMART goals. But what I've really come to the realization in the last few months is SMART goals are complete garbage. There's nothing smart about them. Now, this is my standpoint, right? And I want to hear, because you're still it seems very much in love with SMART goals. So I do want to know your perspective on things. So I'll tell you just my quick rundown. Specific, right? So the goals are specific. Let's say you want to lose 20 pounds in 3 months, right? It's a specific goal, something you can write down and actually track and get to. The problem is it also limits you in that sense. If you're saying you want to lose 20 pounds in 3 months, who's to say that you couldn't lose 30 pounds or 40 pounds? Like, why stop at 20, right? So it actually limits you from the goal you could truly reach. Measurable, right? 20 pounds in 3 months, certainly that's measurable, and you could track progress towards something. But if you're really looking at achieving a big thing, a big vision, you're going into the unknown. You don't know what that's like because you're not there yet, right? And so, like, you come into Hawaii, you've never been there before. It's a completely unknown space. How can you measure something that you don't know anything about? We can go down the route, right? Is it achievable, right? We're human beings. We're infinitely intellectually curious, right? And the ideas that we can come up with. A great example is the 4-minute mile, right? People used to say a human being could never run a 4-minute mile, and then it was done, and done again, and done again. So who's to say that something is not achievable, right? Is it relevant? Well, if it's not relevant, why are you setting the goal in the first place? And then, is it time bound? Well, again, it limits you, right? If you're saying, let's say, 20 pounds in 3 months, what happens when you do it in 2 months? Or what if it takes you 4 months, right? So it limits you, in my opinion. I think if you're really trying to achieve something big in life, SMART goals are not the way to go. And I read a fascinating paper on this topic. It was actually published in 2009 that actually talked about how goals were overprescribed and how goals really should be used as prescription strength medications. That was the word that was used in the paper. And obviously that line resonated with me as a physician. But some of the examples they gave was Sears in the 90s set these sales targets for the auto repair shop of like $147 an hour worth of repairs or something. And so the salespeople, in order to meet those goals, oversold customers on repairs that were needed in order to meet those goals. Enron had sales goals that the executives met until the very last day that Enron still existed. And we all know what happened to Enron. A really bad example is the Ford Pinto, right? Ford tried to bring a car to the market for the masses for like under $2,000 or something like that. And as a result, the engineers and everybody cut corners in order to meet that sales target. They met the sales target, and then people died as a result. And so in my mind, goals are actually very dangerous, and they're also very limiting. If you're really trying to achieve something big, goals are not the way to get you there. So that's where I'm coming from. And again, I was trained on SMART goals. They were hammered into my brain, and I used to love them. They resonated with me. I was like, oh, that makes sense. But I've come to a different realization. So I want to know what your perspective is on SMART goals. How are they used? What are the benefits? When should they be used? In sort of that standpoint.
So for me, like you said, I'm a fan of SMART goals. And I think for me, when you talk about SMART goals, I go back to, you have to be in reality. See, everybody has a goal, right? Our goal was to get to this podcast today, but what was the reality for us to get to this podcast? What do we need to do to get to this podcast? So when I work with a potential customer, a potential client, a business, an organization, as a healthcare consultant, it's how do we set a SMART goal? And what are the little individual milestone markers or deliverables that we need to achieve to get to that end goal? So when we talk about SMART goals, once again, for me to come to Hawaii, right? Is it specific? Yes, I want to move to Hawaii. Is it measurable? Did I get there? Did I not get there? And like you say, is it attainable? All of that stuff. We can do that. But in the meantime, the SMART goal for me is that end point. Now I have to work within that SMART goal and identify different milestones or different markers that I need to meet to get to that SMART goal. So when I'm teaching it, it's not just this is the end all be all, right? And if you achieve it to your point sooner or you exceed it, then okay. But this was your target point. And I think why I push SMART goals and why I'm a fan of SMART goals is because so many people try to achieve something. They want to achieve great. They want to be a physician. They don't have a high school diploma, right? When I help somebody with SMART goals, we're able to say, okay, this is the end goal. Now let's get to reality and how do we work to get to that end goal? So once again, to me, that is the foundation, that is the base, that is the target, that is where we want to go. But I have to have these different milestone markers to get us there. So it's not just to your point where you're beating to your head as a student, right? I tell them I'm teaching a course now, and I'm like, what are your SMART goals? But how are you going to get there? And I'm working with them, right? Because everybody, it's easy to just throw something on paper, but is it true? You know, I had students say, I'm going to pass my check off this week. Yeah, but how are you going to do that? How do you do that? Are you going to study once a day for 30 minutes and whatever? Like, how are you going to do that? And if you need to make adjustments to your goals, it's okay to make adjustments to your goals. But we should only be making adjustments to our goals as we start to get closer and see that we're not going to hit that target. If we're not going to hit that target, let's readjust that SMART goal. Let's readjust that end goal. But also, we have to tweak what we're doing because obviously what we're doing is not working for us. So as a coach, once again, I help my clients. They come on board for 3, 4, 5 months, whatever it is. And if your end goal is to get a new job, okay, how do we get you there? What are the actionable steps, right? Because once again, it's great to say things, but how do we get you there? Is it going to be a new resume? Is it going to be updating your LinkedIn? Is it going to be going back to school? What is it going to take to get you there? But I believe a SMART goal allows you to set the core metrics and set everything you need, and it gives you something to strive towards. It's like a vision board, right? Why do people do vision boards? I used to not be a fan of vision boards, but I see it now. You need to be able to fit, for me at least, you need to be able to physically see it, right? And when I set goals to people, it's not just something that's in here. I tell people all the time, right? If my goal is to come to your podcast today, as it was, right? I told my wife, I said, look, by 11:30, we need to be back home. We need to, at 11 o'clock technically, we need to be back home so I can get to this podcast. Goals are no good when they're just sitting here, whether they're SMART goals, whether it's your way of thinking of goals. If you're not sharing it, if you're not printing it out and you're not giving it out so people can hold you accountable, then it's just a thought. And what we do as humans is we keep moving that thought down the road. We kick that can down the road. So to me, once again, that SMART goal is something that I can, tangible object that I can print out, put on my wall. I can tell my wife, and she knows how to hold me accountable as we move towards that goal. So I go back to Hawaii again, right? As time was getting closer and I'm sitting here trying to back out, my wife was like, no, you said we were going to do this on this day and this is how we're going to get here. And there was something tangible that she had and she was able to hold me to. And that's why I'm a fan of the SMART goals. And that's why I push it, whether I'm teaching as a professor or I'm working as a coach to someone.
Yeah. No, I think if you have a specific deadline or something specific like this podcasting, I think you can make that a goal, right? I think that's fine. For me, the problem with it is, well, for one, what do you do once you reach the goal? Then what? Right? Now you're back in the void, back in the ether. Now you have to set another goal. So you brought up vision boards, right? To me, a vision is much more powerful. You have a vision of where you want to go, right? You don't know what it's like to be there because you're not there yet, right? You've never achieved that. You've never been in that space. You don't know what it's truly like to be in that space. It's truly just an idea, a gestalt, a vision. But everything you do should be aligned with getting you closer to that vision. So every decision point, you just have to ask yourself, will this get me closer to my vision or will this take me further away from my vision? That's all it takes, right? You don't need to set goals for that. As a matter of fact, if you think about that success ladder, right? Everybody knows that success ladder, 100 steps and there's whatever success on top. You don't really know what each step is, right? People, I think, conceptualize that each step is a different goal, but you only know what the next step in front of you is. You don't know what the next step after that is because it's an unknown. You're not there yet. You're not close enough to figure that out. So how can you set a goal for something that you don't even know what it's like, what it is, because you're not there yet?
You know, I think to your point though, and I want to interject here, right? Because when we talk about goals, right, in your position, right, to me, when I achieve something, those dopamine receptors are firing, right? I'm excited. I've achieved it, right? So when we talk about anything, and I work with some of my clients, and I have to say, you have to celebrate the small wins, right? to me, and I understand your philosophy is different, right? We talked about the vision. That's where you want to be. In order to keep the average person engaged, they need to feel some level of dopamine. So many people fail, whether you call it a vision, I call it a goal. So many people don't reach it, right? If they did, the world wouldn't be in the situation that it is in now. So many people, and if we're being frank, we wouldn't have jobs as coaches if people understood it how you're saying it or how I'm saying it, right? We're saying, so people wouldn't do that. But for me, as I tell them, right, we're gonna set these small goals, and when you get there, you're gonna celebrate that, right? So when you said earlier, what happens when you get there? Well, I'm never working on one thing at a time, right? My goal is to come to Hawaii and do X, Y, and Z, right? Even right now, I'm not just focused on becoming a doctorate prepared nurse, right? I'm running a business. I'm doing that. So we're working on achieving that goal. And then for me, right, what's next? I already know what's next for me after I achieve the doctorate. I want to go on to write whatever. But for a lot of people, they don't have the wherewithal or the understanding that, to your point, right, what happens after that. And I think that's where, whether it's myself, you, or someone else, we get to come in and say, okay, but once you achieve that, what's next? What's going to be next? So you're not just sitting there holding the bag. I lost 20 pounds. Well, what's next after you lose 20 pounds is you got to maintain it. So how do we maintain it, right? But that's where it comes in. So once again, whether it's a vision, you got yourself on a board and you're looking slim and trim. But now what's next is, how do you maintain you looking slim and trim? And if that is your vision, that is your goal, whatever it is, no matter what it is, I just want whoever to be their best self. So if they align with a vision, they align with a goal, however they align, do it and be great at what you're doing, and then come up with a success strategy to get there.
Yeah. No, so to your point, I mean, let's use the example of the weight loss, right? If you want to look like this, right, like Arnold Schwarzenegger,
I thought that was you,
right? Yeah. No, if that's the vision, right? You want to be a bodybuilder, you want to be healthy, right? Or whatever you want your body physique to look like, then that's your vision. That's what you're working towards. It doesn't matter. You're gonna lose those 20 pounds. Maybe not in 3 months. Maybe it'll be 2 months. Maybe it'll be 6 months. But you will lose that weight as you work towards a healthier vision, a healthier version of yourself. And I don't think you need any specific goals for that. You just need to align your life with that way of living. Same with achievements. And that's one thing, I'm curious about your perspective, because I agree. You do get that dopamine rush after some achievements. And I have, just like you, many achievements in my past. And the problem that I've had after college, med school, right, residency, going through the Air Force, all the different certificates and degrees that have come along with all that, all these expensive pieces of paper that could be hanging on my wall, right? Really expensive wallpaper. Let me just say that, right?
Yes.
You get that dopamine rush, and then the question afterwards that I always asked myself was, well, now what? Now what do I do, right? Because there wasn't that big picture of what it is that I was actually trying to get to, right? That big vision that I had. And so each step of the way was a goal, right? I need to graduate college. I need to, get into the honor society. I need to graduate medical school. I need to get a good resume. Right? All these are different goals along the way that made me achieve certain things that society thinks is really cool and awesome, but it left me empty afterwards, right? Because then I was like, well, now what? And you keep seeking those dopamine rushes, like you said, and maybe that's why nurses love all these advanced degrees, because it's always like, well, now what? Because honestly, what are you going to do after your doctorate? Because that's it, right? I mean, where are you going to go? Unless you get a PhD, right? Unless you add that PhD now afterwards, what are you going to do?
Listen, I know where I can't say what I'm chasing after, right? But to your point, whether it's dopamine or not, I think with nurses, and you brought up nurses while we go ahead and get the advanced degrees, right? The medical field is the only field where we're listing those alphabet soups after our name, whether it's nurses, MDs, right? I see MDs go back and get PhDs, and I'm like, what? I see MDs, list their MBA and all this other stuff, and it's interesting. That's the healthcare field for it. I don't know why we are impressed with ourselves. My wife's a teacher. She has a master's. She just writes her name. The principal, he just writes his name. He's the whole principal. The superintendent, he's just writing his name. It's not doctor so-and-so. So it's always interesting. But to your point, right, I think we're, for some of us, right, we're always chasing that dopamine high. What's next? For me personally, right, I'm always looking at, okay, I achieved that, right? I met that goal. Now what's next for me? And I think a little bit of me, and I can only speak for me, is I'm African American male, right? I am from Detroit, Michigan. I graduated high school with a 1 GPA. I should not be sitting here speaking with you. I should not be sitting here in Hawaii, but I am. So for me personally, when I'm chasing these dreams, these goals, these visions, whatever they are, is how do I set the standard for the generation behind me? How do I show my daughter that she can be anything that she want to do? So when we talk about me, and that's maybe one of the things I have that's I don't want to say an issue, but it's me, right? I want people to know that you can achieve anything that you want to do. So when you say it, what's the next thing that I want to do? I won't tell my wife this, but I want to go to law school.
All right, we'll keep that on the down low. It'll just be between you and me. No one else will hear about this.
but so to your point, right? I'm already thinking if my SMART goal or my vision was to get through nursing school, right? Get the DNP, and I share with you, right? I'm literally only getting the DNP just to show my daughter and the people behind me, my cousins, my family, my friends. It can be done. If you want something hard enough, it's going to be trials and tribulations. You're going to have to do it. Same with you as a provider, right? And you got it. And then you realize, to your point, right? This is not what I want to do. I want to do something different, right? And it's okay to change the road. But for me, I'm literally obtaining the DNP so I can have a seat at the table. When I come to your table, you can't say, oh, this is an exclusive club. It can't get more exclusive than me with a doctorate, MBA, and all this other things, right? But also, from that standpoint, how do I pivot? Now I want to pivot and go get my law degree because why not, right? So, yeah. My wife will be happy about that. But I want to show the next generation, no matter who it is, diversity matters, right? No matter who it is, that you can do anything that you want to do. You can graduate high school with a 1 GPA. Your 8th grade teacher from Detroit, Michigan, Longfellow Middle School can tell you by the time you're 18, you'll be dead or in somebody's jail, and you can stand up and show her something different.
Yeah. No, that's beautiful. That's fantastic. I think we all should live our lives like that, as truly as a source of inspiration, at the very least for our own children and our own family, but even more so for the world at large. So I love that. I appreciate the candor. Thank you for humoring me on those discussions. And I'll spare you. I have a really a stone to grind with the term provider, but we'll skip that in the interest of time today.
So are you not? What's your thoughts on provider from MD perspective?
That term is complete garbage. It should not be used. You're either a physician or you're not.
Very interesting.
It's simple as that. And the short story behind that really is if you even look at the data, right? Or not even look at the data. Forget the data, right? My daughters go to urgent care quite a bit. They get sick a lot, and my ex-wife takes them to urgent care. And there's a person who walks in with a white coat. My ex-wife, who is a nurse, calls these people doctors. They have never seen an MD or a DO at an urgent care, right? They're not doctors. They're providers, but they're
so PAs. Do they have a doctorate degree?
No, they're either certified nurse practitioners or physician assistants.
Then I would go with you and say that if you didn't earn your whatever, you're not a doctor, right? If you're NP or a PA, you to me are a provider. But I do think that if you earn a doctorate, I do understand that it can get confusing. And I'm not an NP, I'm not a PA. I don't. It's not one of my worries I have to worry about. I'm Dr. Kirk in school when I get the DNP, right? But I do understand how that can be confusing to somebody. And it's very interesting. Like you said, your wife's a nurse, where she would call these people doctor. And it's probably out of convenience, out of habit, because I'm sure she knows the difference. She knows that that's a PA. She knows that that's an NP. So, we're going to have to do a podcast on that one.
No, for sure. And like I said, her, just like you, has that medical background and still refers to these people as doctors when they're not, right? And so the average person doesn't know the difference. And what really bothers me is that, we talked about the nursing shortage. There's absolutely a role for NPs and PAs in our healthcare system. The problem is that we're spending more money on creating more nurse practitioners and PAs than we are creating physicians. And we have data that shows that because these people have far fewer years of education, they actually have delay of care. delay to diagnosis, increased expenses due to increased testing, instead of actual clinical experience at the bedside and trying to figure out what's really going on with someone. So they actually are a detriment to our healthcare system in the current implementation of them. And so I think it's very big, and it bothers me that they can do the same job that I can do, and we're all under the same label as providers, when, again, I'm a physician, they're not. And so some of them recognize that, yeah, I know I'm not a physician, but guess what? I can prescribe the same stuff you can. I can write the same orders in the system as you can. I can bill for the same services and get paid the same amount as you can, right? It just makes no sense. And so that's...
I think to your point, yeah. So that's going to be a different podcast, and so right. I'm very clear. That's not me, right? I'm not a PA. I'm not an NP. So I have no dog in that fight. I can't say for one or the other, right? I have no dog in the fight. What I will say is that if you're not physical DR, whether it's a MD or whatever, I think I will entertain that conversation, right? Should an NP who has a doctorate or a PA who has a doctorate be called a doctor? I will entertain that, but I have no dog in the fight on. To your point, right? The difference of work levels and things like that. I don't know enough, and I'm not an NP or a PA to be able to defend them. So I don't want to even put myself in that situation and be dragged through the comments for not defending when I have no dog in the fight, right?
No, that's totally fine. Like I said, let's not go off on that tangent. We've gone off for a long time. Let's not be serious. Let me ask you some easy questions. These questions come out of my S.I.M.P.L.E networking toolbook. Actually, I got an extra question out of the second version that I'm working on, but these are just simple questions, again, coming back to who you are, right? So let's start with the simple question. Obviously you've been around the world. What is a place you haven't been to yet but really want to visit?
Alaska.
Okay. What about Alaska?
You know what? I want to see the Northern Lights. I also wouldn't mind, seeing dog sledding, huskies, running and racing and all of that stuff, right? And I live in Hawaii, so, I don't, for what it's worth, right? When I was in Detroit, I saw snow. I don't see snow. So I want to see the first snowfall. Obviously, Alaska's snowing all the time in certain parts, but, I would love to go and visit, right? So that is probably one of the places, and it's very interesting to say that, because if you generally ask me, I always say, I want to go to the Eiffel Tower and lean on the Eiffel Tower. I want to go to Fiji and drink Fiji water in Fiji. So those are things that I wanted to drink. Hawaiian water, right? You buy that water back in Detroit, and then I get here and realize, oh, okay, now I'm here and I can drink Hawaiian water. Now I don't even drink it no more.
Oh, that's so awesome. That's so funny. Well, all right. My next question to you is, and this is actually out of the second version that I'm working on. Where's your favorite thinking spot? Like, where do your best ideas come from?
Generally speaking, if I can be as frank as I can, I'm always thinking, so when I should be going to sleep, and my wife knows it because she'll nudge me and say, you need to turn over. It's usually when I'm laying in my bed on my back and it's just me in my thoughts. I'm processing the day, what I should have did, what I could have did, and how I could have handled something. And then I'm organizing my thoughts for tomorrow and the weeks to come, right? So generally speaking, it's when I'm laying on my bed. Now, back in Detroit, we had a house, and I had a room that I used to keep my DJ equipment. And believe it or not, DJing for me was therapeutic to process my thoughts. I would play different records and things, and I'm just processing my thoughts all while mixing. So, I'd love to get that back here in Hawaii when we can finally afford a house, to be able to have that room that I can go to that's mine, so that I can really process my thoughts. Here in Hawaii, I don't have it, so it's really when I'm laying in bed and I'm processing the day, and then I'm thinking about, the days to come.
Yeah. No, that's beautiful. Yeah, to me, it's either the shower or just like you, it's in those moments right before I fall asleep. And what bothers me is, right, I create these incredible thoughts, like these incredible speeches or posts that I want to do, right before I fall asleep. And then when I wake up in the morning and I think about it again, I'm like, it's just not as good as it was the night before. So yeah, I totally hear you on that one. Now, my third question is, you have mentioned dogs a few times. This is by far the weirdest question I have ever come up with, but it's also my favorite because of that. Would you rather have a cat that barks or a dog that meows?
Ooh.
If your asthma allows. If your asthma allows.
Yeah, so my asthma would not allow. I can't have neither one. So this is definitely a philosophical question. But I think the rarest kind to me, I think it would be a cat that barks.
Okay.
And I get the cat that barks, and I'll say the cat that barks because cats are usually cute and cuddly. But if somebody was trying to enter my home, they would bark, and you would think it's something aggressive. But it's really just a cat, so hopefully it scared you off because, right, when we see a dog, we think aggression. But we also judge their aggression based on their bark.
Yeah, true.
And if I see a dog, you can have a pit bull, and we know pit bulls are aggressive. But if it says meow, no, you're not aggressive. You're not doing anything. You're not. You're not doing anything. But if you come to my door, knock on the door, and you hear woof 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 woof, you're not even gonna try to enter. I mean, unless you're crazy. Generally speaking, you're not gonna try to enter. But all along, it's this cute little Persian cat.
I love that image. Oh, I love that image. That's so awesome.
So that was a good question. But I think that I would go with the cat with the bark.
All right. I love that. I mean, that's beautiful imagery that no one has ever put this way before, and I love that. That's fantastic. All right. The other theme of this podcast is every guest gets to ask the next guest a question, not knowing who that person is or when we're going to record. Ooh. So Scott McAllister left you the following question. I think it's a perfect question for you. What do you want your legacy to be?
That is a great question. And if I have to leave my legacy, it would be that I dared to do what others wouldn't. And what I mean by that is, and I go back to me in general, just growing up in Detroit, Michigan, low income, single family household, right? When I told people, I wanted to go into healthcare, they said, well, why are you doing that? You're a male. What are you doing that? Your father owns real estate. Once you try to go work for your father, you have a ready-made company there. You just got to go put up with your dad and work for him, right? There's no guys in healthcare. They're not nurses. What are you doing? To the fact that, you graduate with a 1 in high school. You shouldn't be doing anything, right? So I defied the odds and did what I wanted to do. Down to us moving to Hawaii, right? When you tell people, hey, we're not moving across state lines. I mean, we did technically, Hawaii's a state, move across state lines, but you tell people you want to fly 5,000 miles away and live where nobody's ever been. Be by yourself. Take your family. I had a 4-year-old at the time, right? And I had my wife. Neither one of you guys have a job. You're just going to believe in yourself. People thought I was crazy. Because how many people will believe, people believe in themselves? But I talk to everybody. I mean, I talk to people multiple times a week. I'm sure like yourself who are doing what you and I did, right? You stepped away from the field. How many people say you meet that says, I want to start this business. I want to believe in myself, but I got to worry about the income, or I got to do this, or I got to do that. And then they just don't do it. One of the things I talk to plenty of people. We want to go to Hawaii. We want to retire in Hawaii. We want to retire in Florida, but they never make it to retirement age. Their health outcomes delay them from ever moving, right? Because now they're on dialysis. Now they have CHF. Maybe they didn't fund their retirement plans. They got kids now with grandkids, and they can't move. So for me, when you talk about my legacy, it is that I truly defied the odds and did what I wanted to do. And I hope that inspires the next generation, right? I want the next generation to see that you can, once again, go into do anything that you want to do, be anything that you want to do. You just have to believe in it. So whether you call it a vision, you call it a goal, whatever it is, it starts with you. It starts inside of you, what you have in your heart. You can meet with me all day. They can meet with you all day. But if they're not hungry, if they don't have that dog in them, that fight in them to achieve, they're not going to do it. What do they say? You can lead a camel to water, but you can't make it drink. You have to want it yourself. So with that being said, my legacy is, look, I wanted it, I saw it, and I got it.
That's beautiful. I love that. Maybe not speaking of the next generation, but at least the next guest. What question would you like to leave behind for the next guest on the show?
Man, listen. Listen. That is a good question, and I know you're looking for an answer right now, so I want to come up with something good for your next guest. So they asked me what legacy I would like to leave behind, and I will ask them, if they can do anything to change the world, what would that be? What would they do? What would they do to change the world? How they want to view it? What would they
Right.
do?
Right. No, I love that. Very simple, and yet could be sparking quite a discussion. No, that's awesome.
Yes.
I love that.
Depending on who it is, you never know what you're gonna get.
Right. No, that's been fantastic. Listen, there's been a absolutely beautiful conversation. I really love to entertain my questions, even if I push back a little bit on you a little bit. So,
that's what it is, though, right? It's called dialogue, and I think to your point, right? So many people are afraid to have dialogue because they're just scared. So it wasn't necessarily pushing back. This is a good conversation, and that's what conversation should be. It's called challenging each other, and that's where you grow outside of your comfort zone.
Yeah, it goes back to the yes people that people surround themselves with that we mentioned, right? It's I don't want you to agree with me. As a matter of fact, I didn't want you to agree with me.
Yeah.
Right? That's why I asked those questions, right? Because you had a very different perspective on things, and right, and I wanted to challenge that. And I thought it was a fantastic conversation. I truly appreciate you humoring me on that journey. So if anybody listening to this wants to work with you, who are your ideal clients? Who do you work with, and how can they reach out to you?
Hey, man, I'm a healthcare consultant by trade and a professional coach. So my ideal client is anybody who wants to be great, right? If you're a healthcare organization and you want to work on your clinical and operational outcomes, I'm your guy to help you meet those clinical and operational outcomes. I focus on risk and compliance. So if you're having some issues with risk, you're having some issue with compliance, you're having some issue with the culture, you contact me and we're going to help you fix that. If you're a professional and you want to enter into the healthcare field, you want to exit out of the healthcare field, I'm going to help you with your branding. I'm going to help you set those SMART goals, set your vision board, whatever it is based on this podcast that you align with, right? I'm going to help you achieve that. So that way you can be your best self in 2024 and 2025 and beyond. And hey, even if you don't resonate with me, right, and you've contacted me, maybe you contact me and said, you know what, Demetrius, I don't like SMART goals, I like vision goals. Well, Demetrius is not one that's going to gatekeep. He's going to connect you with Felix, and Felix is going to help you with that vision board and everything else. So, how do you reach me? You reach me on LinkedIn, right? Or you can contact me directly, 313-314-8267. I'm on LinkedIn at Demetrius. You can follow me on all socials at Your Healthcare Consultant.
I love it. I'll make sure all those links are in the description below so people can find it easily and readily and connect with you. Awesome. Any last words from you for the world?
Hey, man, just to you, thank you for allowing me on your platform, me to share my views and opinion on your platform. As I always say, sometimes they're not as favored by others, but you welcome them on your platform, and I appreciate you taking time out of your day to interview someone like me. Once again, you could have talked to anybody in the world, but you chose to spend some time with me, and I appreciate it.
No, absolutely. And that's why I love doing this, right? I do want to hear other perspectives, other people's opinions. I do want to challenge myself even in this, right? Because I don't know that I've figured it all out. I'm still looking for all the answers. And as a matter of fact, I just had this discussion with a friend of mine the other day. He turned 42, so I wished him happy birthday. And I was like, hey, how are you feeling? And he's like, I don't know, dumber than ever. And I said, to be honest with you, the more I learn, the less I know. The more I learn, the less I know. And so, like I said, I have more questions than I have answers. And the questions just keep coming more than and faster than the answers do. So, no, I truly love this conversation. I love the little banter, and I love seeing your perspective on things. So thank you for taking the time out of your day to take away from your wife and your family to be on here today and record this episode. So thank you so much for doing this.
Thank you again.
All right. I really hope you enjoyed that. The questions that I asked towards the end are from my new book, The Simple Networking Tool. It's a great book that redefines how we network. It's all about who someone is and not what they are. So if you want to get your own book, it's available on Amazon. If you want to learn more, there's videos about it here on YouTube. So you can check out this amazing new social science experiment. I'm so excited for it. If you do get a book and you do start your own, please let me know how it goes and what your experience is like. I'm working on the second edition and I want to make it the best one yet. So be sure to tag me, let me know how it goes. Thanks for watching.